all the medical students are depressed. Yes, all the medical students are depressed. If we talk about the incidence of depression in India, it's close to 15 to 20%. But according to a recent meta-analysis, it is seen that amongst the medical students and doctors, this incidence is close to 40%. That means more than twice or close to double of that of an average Indian population. So, what makes doctors more prone to depression? What is the problem we are currently facing, and why medical students and resident doctors are depressed? Hello everyone, I'm Dr. Divya Madan, and today we are going to discuss about a very important topic, that is depression among the medical students and resident doctors in India. If you are someone who is new here, I am Dr. Divya Madan. I am currently a practicing senior resident doctor in pediatrics and neonatology in New Delhi. And being a medical professional with mental illness herself, I was diagnosed with panic disorder, that is F41.0 according to that DSM-5 criteria, which is basically a psychiatric cookbook that gives criteria for defining or diagnosing mental illnesses. One such mental illness that is very common amongst the medical students and residents is depression. And recently on my Instagram, I posted the story. I asked a poll asking all the medical students and junior residents if they have ever felt depressed during their preparation phase or during their journey in MBBS, as well as working as a senior resident or junior resident doctor, and the results are there. Yes, so I can safely conclude that if you are someone who has never ever felt the symptoms of clinical depression according to the DSM-5 criteria, then you are really a fortunate person. And a lot of us at some point of time have experienced all these symptoms. Let's brush up what is DSM-5 criteria. It's very important to know the exact criteria, because you can a lot of times feel sad and grief and sorrow. These are human emotions that make us human and nothing else, but they are very different from clinical depression. We often confuse and use these terms synonymously, but being depressed is something else. Let's look up into the DSM-5 criteria. It's been close to 4 years in pediatrics now, so I have with me my laptop here on which I have DSM-5 criteria here. Let's go through one of each of these points and let us know why, as medical students and junior resident doctors, we are more prone to feeling all these symptoms, and my experience how I also somewhere felt into this criteria during my MBBS. So firstly, let's talk about this DSM-5 criteria. So DSM-5 criteria is basically to receive a diagnosis of MDD, that is major depressive disorder, that is commonly known as clinical depression. So it says that a person must exhibit symptoms that significantly impact their daily life and experience a depressed mood or loss of interest in daily or pleasure activities for at least 2 weeks. So this has to be, there is a time bound criteria that you have to feel depressed, loss of pleasure in the daily activities or loss of interest in the activities that was earlier pleasurable for a duration of 2 weeks. The criteria A says that individual must experience 5 out of the following symptoms in the same 2 week and represent a change from the previous functioning. At least one of the symptoms is either a depressed mood or loss of interest or pleasure. So out of these, we need to satisfy 5, and one of these symptoms should be either depressed mood or loss of interest or pleasure, that is known as anhedonia. So the first is depressed mood most of the day and nearly every day. Second, markedly diminished interest or pleasure in all or almost all activities for most of the day, nearly every day. Third, significant weight loss or while not dieting, or weight gain or decrease or increase in the appetite. Insomnia or hypersomnia nearly every day. Fifth is psychomotor agitation or retardation nearly every day. Sixth is fatigue or loss of energy nearly every day. Seventh is feeling of worthlessness or excessive or inappropriate guilt. diminished ability to concentrate or think, or indecisiveness nearly every day, recurrent thoughts of death, recurrent suicidal ideation without a specific plan or a suicidal attempt, or a specific plan for committing suicide. This is the criteria A. We need 5, and at least one of these should be 1 or 2. Criteria B is impairment, that all these symptoms should be causing some impairment in the social, occupational, or other important areas of functioning. And criteria C is episodic characteristics, that this episode should not be attributable to the physiological effect of any substance or any other medical condition. And criteria D is the exclusion criteria, that occurrence of this episode is not better explained by any other schizoaffective disorder, schizophrenia, that means any other psychotic or delusional disorder. So that's it for the DSM-5 criteria. So if you take out all of these symptoms, I'm pretty sure that if you're someone who is in the medical field or currently a practicing doctor, and if you recall your journey, then definitely at some point of time you would think that yes, I fit into the definition. I might have been clinically depressed over that time, and a lot of time we normalize this feeling of depression and don't seek out help. It definitely affects our day-to-day functioning, our relationships, our studies, our overall growth as a person, as an individual. And a lot of times we just ignore these thoughts, ignore these feelings, and try to work even harder and ignore our mental health, and sometime in the future it flares up, stays as a trauma. So I was very curious that why do medical students are so prone to fall into this depression categories, and surprisingly there are a lot of studies regarding this subject only. A lot of clinicians like me were curious, a lot of researchers were curious that why medical students are so depressed. So let's look at some of the studies. I have it's easier to tabulate them or give pointers as to why medical students are more prone to fall into depression category. So let's go one by one. I'll go point by point and attach the study that was done associated with that. So let's begin. Let's start with a study in 2010. So the study assessed depression, anxiety and stress among the final year medical students in Malaysia, a score, that is depression, anxiety and stress scale -21, and the study reported that final year medical students, they have high level of depression, close to 41.2%, anxiety is even higher, 53.3%, and stress is 32.9%. Prevalence of depression, anxiety and stress among young male doctors during their internship period, Nasir et al. 2020. The study investigated the presence of depression, anxiety and stress among the male doctors during internship in Bahrain using the same scale, and they found that around 66.7% of interns experienced symptoms of depression, 76.3% experienced anxiety, and 80% experienced stress. Studies in India in 2018, depression, anxiety and stress among the Indian orthopedic PG students was done, and they found that 72.7%, a whooping 72.27% postgraduate students experienced depression, 63.6% experienced anxiety, 68.2% experienced stress. So it's very clear out here that we are depressed. All the medical students are depressed. Let us understand what all risk factors make us prone to this depression. Study from 2005 between the perceived stress, perceived social support and depression in medical students was taken into account, and they found that one of the major risk factors for this stress and perceived stress and depression is a very high academic pressure and overload. I remember my second year and third year of MBBS, where in the morning you have to attend lectures, you get free around 4 p.m. and after 4 p.m. because of that high academic load and exam time and frequent assessments, you either study in your room or in a small space where you don't have any human interaction, or you go into the library where everyone is submerged in their books or materials, and again you feel so secluded, so isolated. So a lot of academic pressure and overload is one of the high risk factors for that. Second is the lack of social support. This is supported by a study done in 2010 where they found that social support and psychological distress in medical students, and they found out that because the students that had low social support, low levels of perceived social support, were likely to experience more psychological distress. Third is perfectionism and self-criticism. We are so self-critical of ourselves. We are so much aiming for perfectionism that we easily fall into this pool of depression. That find out depression and suicidal ideation in the medical students in China, a call for wellness. This was in 2018, and they found out that because we have exposure to patient suffering, death, and other emotionally challenging situations during our clinical training, they predispose us to develop these suicidal ideations and depressive symptoms. History of mental illness is a risk factor. Medical students that have a history of already existing mental illness or some genetic predisposition are more likely to fall into this trap. They found out that females are more likely to be experiencing these symptoms of depression and anxiety as compared to the male students. Financial stress, especially for those who join the private medical colleges, or even if you are not joining private medical colleges, in government medical colleges, if you prefer reading through textbooks, the hard copies, then they are comparatively very expensive, and a lot of apps are now preferred which are very expensive, I believe, if you take subscription from first year itself. And lastly, poor coping mechanism. Children, they have ineffective coping strategies, and they use strategies such as avoidance or denial, that these feelings are just normal, and because of these denial and ineffective coping strategies, they are linked to have higher risk of depression. The high academic pressure, our sleeping schedule is very bad, and these sleep problems are also associated with increased psychological stress, so that could be another risk factor. Being in the medical profession, there is a lot of stigma and mental health taboos. So despite increasing awareness, the stigma surrounding it prohibits you to seek help, and it can also impact your future judgments, especially if I talk about my incidents. If I ever tell anyone that I have this mental disorder, I am suffering from it, I was diagnosed and I am in the healing phase, then definitely my decisions would be judged as compared to a person who says I don't have any mental health issues, right? So because of the stigma around, and because of the fact that people still look upon it as something, a taboo, look upon it, makes it even harder to seek help in such stages. So the final call, I would say that if ever you felt such symptoms, and especially if you have thoughts of suicidal ideations, and if you feel that you're not able to do your day-to-day work, please consult some medical health professional, someone specialized in psychiatry, and don't and spread awareness as much as you can. Be empathetic of your peers who are suffering from this mental health issues. And that's it. I know it's a very sensitive topic, but the more we speak about it, the more we are going to normalize it. So that's it for today's video. I hope that you find it helpful and you feel heard. I try to incorporate all the data and research I did in a small section of video. And if you are someone who are suffering from depression, or you feel that you are not working to your optimal stage, please do seek support. There are a lot of apps also available, and if you are already in a hospital, working in a medical college, don't hesitate to visit your psychiatry department. The more we speak about it, the more we are going to help each other. Thank you. That's it for today's video. Thanks for listening till the end. Do share your thoughts in the comment section below. Bye bye.